guys, I'm shooting this video on my way to the storage. Today I have 10 small boxes in my car, so I can feel my car is a little bit heavy. Anyhow, I think this is a good time for me to talk about some stuff. I just ate lunch, egg sandwich, same as euro. You know, there's one thing I noticed that I have not found the best one is a phone holder in the car. I tried so many kinds, I just haven't found one yet. And then the other one, yeah, so it's kind of frustrating. I tried the one stick on the car dash, but I don't really like it because I don't want people to see what's on my phone, especially when we stop. And then I have one, I like the ones that stuck in your fan, but then I don't have it doesn't have a good one. But anyhow, so today I want to talk about something that happened to me this year about medical bills. I tried to talk about this a few times already, and then I didn't record it, and I don't know. I just trying to find the easiest way, quickest way to record these and upload to YouTube. Okay, let me get to the point. So I have insurance. To me, health insurance is cheap. All right, because I've been working in the hospital since 2010, and my insurance was by the hospital, was through hospital, and then they give you incentive points, like you go to gym, you go to walk, and then they have an app, and you record your points at the end of year. Once you get to that level, you got reimbursed from your health care from the hospital. And then it's cheap already. I pay like $8 per paycheck, so less than $20 per month, right? I thought that house, but then when I see my friend's house premium through employer, they pay like $80, $100 a month. They don't even get cover 100%. Mine's like 100%, as long as you're in the network. So so it was all good. And I actually work at 3 hospitals. Okay, one in Cleveland, Ohio. It was. I'm talking about medical insurance. It was okay. It was actually best because the hospital was the best. And then I worked for one hospital when I moved to California. And then 2023, we merged with a bigger hospital in Pacific West. The headquarters was in Washington State. I changed an employer there after merge. And the last one was the worst one I ever experienced in my whole life. I worked at bank before, I worked at all different industrial. I never had this problem, alright? So I don't know, is this because everyone acting this way now, or is just because this particular health insurance, or what? I have no idea, but I never had happened before. So after November, right, I was an employee from this hospital. And then this year, seriously, after I got no job, no insurance, all of a sudden I got 3 bills. One is a dental bill, the $300, and one is some kind of lab bill. The lab is a preventive care annual checkups. Okay, I shouldn't pay anything. And the thing is, it was April 2023. That was a visit. I got it 2 years later. How ridiculous is that? Where that even coming from? All right, that was like $100 something. year, 2024 May, I did coloscopy. Sorry, I don't say the words well. And GI. GI is the other one that is they stuck the a video camera into your stomach. So that one I got $3,000. I was like, no way, cause all these is medical, right? It's all should be covered 100% under my insurance policy. Okay, let me just do a summary first. And then just last week, I got another bill all the way in 2022. In November 2022, I got a COVID. So I went to COVID mobile clinic to do, just like everyone else, right? I go check to see if I have COVID. I've done that many times, during 2022. And in California, I think everything's covered, COVID related, even you don't have insurance or something. Or it doesn't matter your premium, everything. So for me, it's 100% covered. Then I got a provider bill. It was like, how much was it? $100 something. Or $300, I forgot. It's a couple $100. And then my friend was like, oh, it's a couple $100, pay for it. Or like, why I'm paying for something I already paid? Basically, I still paying premium monthly, right? Even though it's cheap. And I shouldn't be paying for this. See, that's the thing. I think a lot of medical insurance, just like everything else, it happened to me too, actually. Like my coworker one time, they went to ER. The insurance should be covered 100% for any ER visits, but then she got billed like $400 something through provider. I was like, no, you need to call them, because it happened to me one time. I got a couple $100 from provider from the ER visit, emergency visit. So I called them. The funny thing was when I call, I don't even explain. She said, oh, forget it, you don't need to pay. Okay, if that's the case, why you mailed me at first? I feel like you're trying to scam people. These things, I guess it's a provider too, trying to, because sometimes I don't know the deal with provider and insurance. The easiest way, quickest way for provider to get money is through you, okay? They wish you don't pay everything. You pay everything, yeah. At least that's what happened to my dental. So, okay, so that's, everything happened this after I lost my job in 2025. That I thought is just really lame, right? So, I fight for it. So I can tell you at the end, I don't need to pay all the bills. The first 3 bills I mentioned, because this $100 provider bill for COVID, I just got last week. I still need to fighting it, because I called the lab. I called the number on the bill. No one answered it, so I have to call. I'll see what happened. I almost felt like, shit, maybe I should just pay for it. But other than that, I think people, I know sometimes just a couple $100. It's a system, healthcare system scam people, right? I think you should, there's so much we don't know. You should have a fight for it, even though it's a couple $100. In my case, it's couple $1,000, especially that GI procedure. I know it's 100% covered. So yeah, let me see this one first, how I got recovered, right? So basically, it's my insurance from the employer that screwed me over. I talked to the first thing, you always want to talk to the health insurance. And another thing too, even though I'm not employee with them, I still keep my insurance card. I was glad I do that, because there's so many information, even though you are expired members for this health, but for past bill you still need a member ID. They have to look you into it. So I'm glad I keep all the dental card, medical insurance card. I never had to deal with this my whole life. This is the first time. So So I called insurance. Basically, they told me it was how your employer set it up, your HR set it up. So basically, the provider I went into to do colonoscopy, he is a tier 2 provider. So in order to find a provider that cover both colonoscopy and GI, I have to find the tier 1 provider. I didn't know because I made an appointment. My friend kind of introduced me to this provider. He said it was good. So I used him. And I actually called insurance, make sure he's in the network, and he was in the network, which is good, right? And then the things that when I visit doctor, he said, well, because I kind of told him I have some concern about my GI system and stuff. So he actually suggests me to do GI, which is just looking into stomach, which was helpful because actually my colon was good, clean, but my GI, my stomach, I have stomach ulcer, all the stuff. So he suggests things that they put me under the sleep, right? And then she said, oh God, I cannot say that words either. So basically they put me in sleep. He said, well, since you do colon, probably just it makes sense you do GI too, so you don't need to put sleep twice. It's actually more expensive if you do that. Instead you just use one provider, doing stay in the hospital, all these procedure one time, easy peasy, right? So I say sure. But one thing I forgot is to call my insurance, make sure he is in that network for GI procedure. Technically, my God, I don't know how to say English now. It's my fault. Yeah, it's my fault because you always want to make sure. Well, I did make sure. It was a last minute change, so I just can assume he was in it, but no, he's not. So yeah, so I did all that, and then so I came back saying, so he's tier 2. So he's not covered for GI procedure. And then what can I do? I'm not gonna pay $3,000. I never know, something like that. So they suggest me to file dispute. So under every insurance, you go to their website, there's a section for dispute. They call dispute, what they call grievance, something like that. Your insurance should tell you. So I did. I asked ChatGPT to help me to write a letter. It was all through electronic. So I sent them email basically to tell, I did not know this, my physician's tier 2. I did call the insurance, make sure. But anyway, so then later they give me a letter. So basically they covered that $3,000 for first time courtesy. They do that. It's not like I'm trying to scam them or something. I just trying to. I know it was my fault. So it was good. So I got that covered. And then the lab bill from 3 years ago, I called insurance because the lab, also called lab, they don't cover anything. They don't do anything after 12 months. So there's nothing I can do. And there was actually a couple. I think one was provider filed wrong insurance. It should be Blue Cross California, not Blue Cross. So it didn't. This came back to me, which is provider's fault. Another one, they did not receive it. So I had to handle all this visit separately. For the one provider's fault, I message provider. I think the insurance just give me courtesy to just cover me. It was like $100 something. And then the other one, the insurance cannot do something. So that's the thing, when you do any big procedure, you want to make sure your provider or hospital sent me the claim. And in my case, I went to lab work, which is covered, and they did not file the claim. So I tried to find that lab. I searched online, everything. I didn't get the right number. And then I remember I had a copy of my, so I actually went to online to see my medical record, right? So in that medical record, they have all the, the doctor who looking at your lab, pathologist, I think. So I searched that person, search which office that person in. Then I actually called the hospital office, the provider's office. And then I think probably maybe that's not first time. It doesn't make me feel like whoever talked to me, the secretary, it was the first time. It just gave me that vibe. She said, oh, contact this person. So she gave me this person's cell phone number. I called them. And that was the lab who made mistake. That was a person. So she asked me all the information and she looked up. She said, oh, you never received the bill? I said, no, I never received bill. It's 3 years ago. I think she said, oh, your name is Megan? I said, no. So basically, I felt like they made mistake. Somehow I don't know how, but they made mistake. So my visit, the time, my blood work was probably under someone else's name. I actually, long time ago, it just something happened too. So she said, okay, she's gonna take care of it. So basically that was taken care of because it's their mistake. Yeah, and then for the dental, also technically it's my mistake too, because it's my employer. They are sneaky, they're very sneaky. I had this dental insurance all my life, and I went to this dentist, but last year they changed the dental insurance, I guess. I mean, I did not pay attention. They mailed me the card. I didn't pay attention that it was actually changed, and I didn't check if my dentist was in the network, So I went in. So basically, whatever dentist insurance they change, she's not in the network anymore. So I talked to the dental insurance company. The customer reps suggested me to file grievance. So it's on their website too. Basically, you can dispute too. Just tell them, oh, this you did not notice your provider was out of network, something like that. So they give me one-time courtesy too. Yeah, they gave me a one-time courtesy. So I was glad that they gave me basically I got that refund. So you just have to fight for it, especially for the big bill. Sometimes people just don't care, a couple $100, I just pay for it. No, don't pay for it. If you already pay the insurance, why you have to pay for it? I know that it took me actually over a month to fighting for it, mainly because I did not understand better. I don't know. I mean, this never happened to me before. I don't know the number. You have to find out real number, correct numbers. So now I got another bill from 3 years ago for COVID testing. Okay, that should. So I called the number on the bill. And then that person said, oh, you have to, again, I do a phone loop again, phone tag or phone loop. I called the bill, I called the provider on the bill. They did not pick it up, okay? And then I called the California something, Medicare. They said I have to call insurance. So that's the next thing, I need to go call insurance. But it was like $100 something. I hope I think I should be able to get reimbursed because I don't need to pay anything that was COVID related. I don't know why that's so sneaky. That's why people that CEO United Healthcare got shot. I mean, I don't say that was right? But it's just a side effect. I mean, all these insurance companies trying to, either insurance company or employer, you have to pay. I don't like people like sneaky, they change something, they just assume, oh, you need to pay attention. I mean, seriously, yeah, we need to pay attention. Sometimes it's like you don't know what you don't know. There's so much things that we need to pay attention. Okay, I got all right, thank you for listening to me. I'll talk to you guys later. I am at storage right now, as you can see. Time to unpacking all my stuff.